Welcome, everyone, back to another episode of the Triplet Double podcast. My name is Isaiah Hernandez, your host, and with me is another guest this week. Been awesome having all these guests past month and a half. A lot of great insight from other triplet dads out there, and I'm working on getting more triplet parent guests, not just dads, but moms. So next week I'll have a mom. Very excited to do this, and being able to have the opportunity to just learn and talk and connect with other triplet families out there. So, with me is Mr. AJ from
Hey,
Wyoming. What's up, AJ?
what's up, Isaiah? Happy to be here.
Is Mr. AJ okay, or is that your father's name?
That
Yeah.
works.
All right, cool.
Yeah, whichever is fine. I respond
Yeah,
to most of anything. So
nice. AJ, I appreciate you had actually not the way you and I connected was funny was because someone else had posted in the Triplet Dad group and they were talking about like business advice and managing the triplets and all this. And I had commented, you had commented, and it was funny because when I had commented, all of a sudden I got a notification from you saying like, "Hey, that sounds awesome! Like I'd be down to check out the podcast." And then
yeah,
that's how you and I connected. So it wasn't like a direct outreach. It was kind of like, I don't know, was that the first time you saw the podcast? Was through that
yeah,
comment?
it was absolutely. And and I've actually gone back and watched some of your other episodes, which has been really cool and really informative because social media is amazing. The fact that you can connect with people that you otherwise wouldn't have ever connected with. I didn't actually find that Triplet Dad group until about 6 months ago.
Oh, cool.
Yeah, and my triplets are 8, so I've been,
Would have been helpful.
yeah, it would have been helpful, 6 or 7 years ago, I think for sure.
That's awesome. Um, okay. So AJ, I think, I you told me a little bit about the triplet pregnancy and that journey with your wife.
Mhm.
Please share with all of us what that journey was like and where you guys are at today.
Yeah, for sure. Definitely happy to share. So we actually had been family planning for 2 or 3 years, and we actually had two kind of sad miscarriages. And at that point, we're like, you know what, this is maybe not our thing. It's a sign from divine intervention that maybe this isn't for us.
Mhm.
And at that point, we had decided to start maybe the adoption process because there's tons of kids in the world that need love. And we were happy to open up our home to potentially adopting. Um,
Yes.
and literally like 10 weeks later, we had kind of stopped trying. We're like, oh, whatever. Like this is pretty sad for us. And so my wife, she came up to me. She's like, hey, like I think I'm pregnant. I'm kind of feeling a tickle here, a tickle there. I had a weird dream. I'm like, great, let's make an appointment with your doctor. Like, let's go get an ultrasound, and like tackle this early.
Do you
She's
remember the
like,
dream?
what's that?
Do you remember her dream?
That she had twins.
Oh, wow.
Which comes back
Yeah.
into play like 2 weeks later. We went to her appointment because we don't really have twins or multiples on either sides of our family. Her grandma was a twin, and that's like literally it.
Yeah,
Uh,
that's like the only thing.
yeah, and so we went in for her ultrasound, and her doctor was like, "Oh yeah, congratulations, you're pregnant." And she's like, "Oh, there's twins. Like this is great." Um, and then she kept on like identifying body parts, like, "Oh, there's a foot. Like, oh, there's a head. Like whatever." She's like, "Wait a second, I see a third leg." And the way that she said it was that like one of the twins had an extra appendage. We're like, oh, modern science is great. Like the no big deal. Like we're not gonna let that bother us. Doctor's like, no, there's a whole other body in there. We're like, okay.
Wow.
The guy's glad I was sitting down, right? Because as we all know, this adds like a whole new level of difficulty when you have a third body. This was like 11 weeks ish. And the like scheduled due date was going to be like the middle of June the following year. And
Hmm.
so she had said, hey, they're all sharing one placenta, like they're trichromo, so they're going to be identical. And at that point, it was like, I never thought I would have experienced something that had such high odds of pregnancy. My background is largely in science. I have a
Hmm.
master's degree in biochemistry. So I've been around genetics and that sort of thing a lot. So hearing that sort of description from her doctor was a, hey, we need to start planning this now. Like they're going to be, they're not going to be able to be carried for 40 weeks.
Right.
So we went home, we broke the news to the family. Everybody's happy. Everybody's in tears, like, because it was such a long road for us.
Yeah.
So that was good. She like didn't have a lot of morning sickness or anything.
That's surprising.
Yeah, like at
Yeah.
all.
Wow.
And so at 22-ish weeks, 24 weeks, she had to go in and have an emergency cerclage. So I should back up. Right after we discovered that we were going to have triplets, they're like, well, we can't handle this pregnancy in Casper, is where our closest hospital is. I'm not even in Casper. At that point, I wasn't even living in Casper, but that's where her doctor was. That's where the hospital is. And they're like, we don't even have enough beds. Our NICU unit is like one bed.
Wow.
For, singletons only, really. Twins,
Yeah.
you can really push it. And so we ended up having to go to Presbyterian St. Luke, PSL in Denver, because of their they have a really renowned triplet set of doctor team down there, and that's where we were referred to. So she had to go down once every 2 weeks for ultrasounds and that sort of thing.
And that's like what, 3.5 hours away from where you were in Wyoming?
Yeah, 3.5 to
Okay.
4 hours, just depending on, as Denver traffic.
Yeah. So then that's every 2 weeks. Okay.
Right.
So not terrible, but still for a pregnant woman to do that drive still
Yeah.
is not fun.
And
That's like, yeah.
my mom at that point was living in outside of Denver in Lakewood.
Okay.
So we were really lucky to have family,
Right.
10 minutes from PSL, maybe. You just boogie down 6th Avenue and you're right at PSL.
Nice.
So that helps. So we make long weekends out of it. We don't have any other kids at this point. So
Yeah. Makes sense.
it worked out really well. However, at her appointment, 24 weeks, they found a discrepancy. I won't go into too much detail about what was going on, but listeners can Google what happened. But she had to have an emergency cerclage
Mm-hmm.
to is preventative to essentially keep the pregnancy going. And as we all know, that there's a litany of, a literal laundry list of potential complications with triplet, twin and multiple pregnancy. So
Right.
you had to go in and they're like, well, you're not going back to Wyoming. You're going to have to stay in Denver. No more than 10 minutes away from the hospital, maybe 15. Well, she ended up living in my mom's basement for the remainder of the pregnancy. So she got to know my mom really well.
Yeah.
But
That's good.
my mom is she's like a fitness guru. At 70 years old, she's doing triathlons and running marathons and doing these insane bike rides and stuff. So she's very fit, and
Yeah.
she worked at a gym in Lakewood. So she was able to get my wife in the car almost every day and take her to the gym and get her in a salt pool. Right. So it has
Nice.
the buoyancy. So
Yeah.
she could take all that pressure off of her midsection.
Right.
And then they moved her ultrasounds up to every week.
Okay. So after they did that every week, and I'm curious, and you probably maybe don't remember, but for them to tell you guys hey, Wyoming, no more. You got to stay in Denver. I mean, I know you run your own company and all that, but I guess financially, insurance wise, would they? I mean, let's just say hypothetically, your mom wasn't there, you had no family there. I mean, does that cost? Do you remember at all? If that cost gets covered?
So our other option was to move into the Ronald McDonald House that was attached to.
Oh, okay, gotcha.
So
All right,
it's all
that's right.
private funded.
Okay, that's right.
It's
Okay,
all private funded, which is really great. If you're looking for some way to help out.
Yes.
Ronald McDonald House, we didn't have to take advantage of it, but I know that they do, a world of good for parents that either don't have insurance or underinsured. Insurance company doesn't want to cover or place to
Yeah.
who knows? Like with insurance these days, like you just don't know a lot of times. Like it's just, it's not like it's easily navigated, right?
Yeah, it's
I mean,
not. Yeah, it's not.
luckily for her, she had still been working at she works at an engineering company that they carry their own insurance. So we were very lucky that they
Hmm.
were able to cover bills for the pregnancy, because we had
That's great.
$1 million babies by the end of this.
Yeah, of course.
Essentially.
Yeah.
So she moved down to my mom's house at 24 weeks. Spent 11 weeks there before the babies were delivered C-section at 35 weeks. And
Wow.
as her ultrasounds went on, they said that baby B was going to be the one that was the indicator of when they needed to be delivered. So at the end of the 35 weeks, they're doing ultrasound and they said, "Hey, you still have fluid in there. Like, you can keep this pregnancy going." And she's like, "I'm done." And
Yeah.
I don't blame her.
Right. Rightfully so. Right.
Rightfully so. So yeah, they ended up being delivered the 9th of May that year, which was just 5 weeks short. Like it was supposed to be the middle of June, and they were delivered in the beginning of May.
That's fascinating. That's such a great achievement. I
Yeah,
mean, it's so hard to stay almost like bedridden. Like, I mean, I know she wasn't bedridden, but like still to have to stay 11 weeks close to the hospital knowing that, hey, any moment this can happen. And
yeah,
you weren't able to because of work, right? You were kind of like you had to go back and forth a little bit at periods of time.
yeah. That's right. So I own my family owns a nutritional supplement company here in Central Wyoming, where we do all our manufacturing in house. So working remotely isn't an option, right?
Yeah.
So I also own a hemp and cannabis company that operates partly out of Wyoming and partly out of Arizona.
Hmm.
And so I don't do any of the manufacture on the cannabis side. I just do all the formulation and that sort of thing. All the written formulation, it gets carried out there down the.
Yeah.
But you know, my dad was here as well because he and I work together. He's a compounding pharmacist. That's actually how I got started into doing nutritionals and that sort of thing. Was working in his pharmacy in the 90s,
Okay.
like a teenager.
Nice.
So yeah, there was no, I tried to make it down to Denver as much as I could, but being apart from your partner, after 7 years of marriage at that point, it's hard, it's tough.
Yeah.
And for her to simultaneously have to live with her mother-in-law, you know,
Yeah, it can go either way,
that's the
right?
easiest thing ever,
Yeah. Yeah. But
So
yeah,
yeah,
that's very lucky though. Very lucky though. I mean, it sounded like they had a good. I mean, it sounded like your wife and your mother-in-law, obviously had a good journey all those
yeah.
11 weeks, and yeah,
And they continue to have a really close relationship too,
that's awesome. That's
which is,
awesome.
which brings into, once the triplets arrived, we were in the high level NICU. Is that level 4? And then they move you down, they downgrade you to 2, or am I getting it backwards? Anyway, we were in highest level. The girls were in highest level NICU unit for 7 days, and then an additional 5 in the downgraded unit. And then
Hmm.
again, talking about insurance companies, all of a sudden, the doctors came in oh, the girls look great. Here's a video how to be a parent, and see you later. I don't know if they made you watch the video, how to how to hold your child, what happens if you get frustrated. I think it's good.
No,
It's great.
no, they gave us paperwork. They gave us paperwork where I was like, "Who's gonna go through all this paperwork?" I mean, we're not gonna have time to go through all this. And come on now.
No, it's
Yeah.
here's how to take care of your child. We just went through 35 weeks of high risk pregnancy, and now they're well, they have to go home with oxygen. See you later. So,
Yeah.
we had been at PSL for 3 weeks at that point, and loading up 3 essentially newborns, preemie newborns, into our poor Subaru Forester and driving back to Wyoming was
It was
interesting.
a journey.
It was a journey. Yeah, I have family in Cheyenne too, so we were able to stop halfway. Um,
Okay.
and then make it home. But it's like, I don't know what I'm doing. You know,
Yeah.
like
Yeah.
I'm getting it, but at the same time, you're like perma exhausted, where you're perma tired, where like you're not sleeping, the kids are crying, like you're up
Hmm.
all hours of the night feeding, and that's what we dealt with for the first 6 months, is trying to navigate like how do we come up with a system to make sure that these identical children, like you can't like, oh, this one, they're identical girls, so they
Hmm.
all like they literally like all looked exactly the same. um
And were they all the same? I know Baby B was going to be, they had mentioned. I don't know if they mentioned it was like, hey, weight she's going to be under or not, but were they all the exact same or similar in weight?
So baby A was 4 pounds 7 ounces. Babies B
Okay.
and C were 3 pounds 13 ounces when they were born. The reason
Okay.
why they said baby B is going to be the one that dictates when the babies are delivered is because she had some weird Dopplers on her ultrasounds,
Mm.
which like contributed to some health complications. She ended up having at about 18 months.
Yeah.
But they monitored her really closely, and I think finally it was like, all right, like we need to do this, right?
Yeah.
Um, and
Makes sense.
so, yeah, I mean, we get home, like everything's good, like we're not sleeping. Like, thankfully, we had tons of help. My in-laws, my wife's parents lived literally around the block from us. My
Oh,
parents
great. That's
lived
awesome.
here. My sister came down from Montana to come, like, just help, like, whatever.
Yeah.
We were doing like 30 bottles a day and
Yeah.
47
Sounds.
diapers or something. It was insane. And so each triplet actually has like a very small discerning mark on them, like just a little bit different, like very, you have
Hmm.
to look for it. So I was able to keep track of them by making a spreadsheet, like baby A, like attitude 1 out of 10 or whatever, on a scale of 1 to 10. Like
Hmm.
we could monitor them very closely. Actually, I still have those spreadsheets. This went
That's
on for
cool.
like
That's cool.
18 months. Baby C drank how many ever ounces of milk. Baby A was happy. Baby B went through 12 diapers or whatever. And so we were actually able to like use our prowess with Excel to monitor like what we call baby living performance. And so from there, coupled with having a ton of help, like we were finally like able to sleep. I was so tired, all the time because for whatever reason, the girls just like didn't sleep all that much until they're about 18 months old.
Yeah.
And they were actually, my wife was nursing them for over almost a year. Not, I mean, we supplemented with formula, which,
Yeah.
I am really, really against like Enfamil and Similac just
Hmm.
because of the ingredients list in it. Like, you gotta be really, really, really careful about what you buy or supplement with formula because of the prevalence of, corn syrup, wheat and corn and soy.
Hmm.
Um, and like, I'm not a granola hippie, but like you need like it's really important for nutrition, like not to give them just sugar, 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 or sugar derivatives. So what we
Hmm.
actually did was found like an organic baby formula from Germany
Okay.
and ended up getting it shipped here. As the times might be, the FDA banned that particular brand from import to the US because they said it was unsafe. So what we did, I have a friend in Calgary in Canada, and I would order it and have it shipped to his address in Calgary. Maybe I shouldn't be admitting this, but he would take all the labels off of it, swap it
Uh-huh.
for like cans of Similac or popular baby formula, um,
Yeah.
and send it here, like essentially like smuggle into the US under false pretense because that was the only formula that we could supplement with that the girls like weren't doing like tons of spitting up. Like we're really healthy with it.
Hmm.
In our like their original pediatric doctor, she turned out she was on the board for Similac. So she was like pushing the Similac. Oh, you don't even need a nurse. This is fine. This is what they need. Yeah. And she just pushed
Wow.
and pushed and pushed. We ended up finding we ended up getting so fed up with her that we ended up switching doctors for a doctor, in another town that just really, really amazing lady. That was like, you guys do you. She got a kick out of the baby formula that we had to like illegally smuggle from Germany to Canada, just to meet the girls' nutrition needs. But yeah, that my friend was a saint, like in Calgary,
Th-
dude. Like, I'm just gonna do this. Like, if it gets
yeah.
taken, at the border, as long as it doesn't like test for meth or heroin or fentanyl or whatever, they really don't care. There's
Hmm.
like with the sheer volume, like I'm sure it was tested or whatever, but they just let it through. I never had an issue. And we're talking like 5 to 10 kilos at a time of this formula. Since I think they've backed off on the ban. But yeah, that was like right when the girls were going through a ton of, their nutritional demand was really high.
Wow. That's an interesting point in itself because I think even in the triplet groups, a lot of moms, it's it's hit and miss as far as how much breast milk they can produce.
Right.
Especially when they have the triplets. Like my wife was able to overproduce a lot because like it's like her body knew that there was three of them, which we were very lucky. We
Sure.
still used formula, um, but and a lot of moms in the group I shared that experience too, where they were just like pumping and freezing bags and saving all that so they can just constantly just pump every 2 hours or however
Mm-hmm.
often their schedule was. But then you do get a lot of, and I can't speak to this, so I'm just completely a neutral voice in this. But you do get a lot of the pediatricians, and you get the hospitals and the NICU, even the NICU people who provide the formula that to help, and are advocates saying hey, this is safe and it can give you what the baby needs, for like not to fully replace, but to supplement the breast milk.
Right.
So it's just interesting because it feels like the not the opinions, but the uh, like I guess people's their own research and their own experiences. You get different outcomes. Like, you know what I mean? So that's where I'm like, it's hard to not believe, but it's hard to like figure out, like, you have to really do your own research and
Absolutely.
advocate for like what you believe is the right call. You know what I mean?
Yeah, yeah, absolutely. No, that's a really good point. And I don't refute that Similac and some of those other
Mm-hmm.
formulas have a high nutritional value. It's just the amount of replacement for carbs,
Mm-hmm.
proteins, that sort of thing. Maybe not the best.
Okay.
Specifically like corn, wheat, and soy products.
Yeah.
So I
Well,
mean,
and then yeah, that's good for you to share because I think that's important that you're not like you know what I mean. I don't think we're advocating. I don't think you're advocating one way or the other. I think you're
no,
mainly just sharing you're sharing what
yeah,
you learned and what you understand, and like,
yeah.
hey, this is what I think. You know what I mean? Yeah.
And making your own choices, making the choice as a parent is one that you need to make. Like I have no dog in this fight really, but as a scientific professional and as somebody that's had to go through this with three newborns, it's important to like do your research, like what's best for your child, because ultimately, like that's going to be your parenting decision.
Mm-hmm.
We were able to be fortunate enough to find that formula out of Germany, that organic baby formula that fit our kids' need, which was great.
Yeah.
Unfortunately, the federal government decided that they know what's best for us, and um,
They
we're
don't
able to
always make
navigate that
the
too. So,
yeah. They don't always they don't always make the they seem to change opinions often, I guess. So,
yeah, yeah,
they don't always make the best choices.
yeah,
Um I think this is a good segment too, kind of about this our main talking point that we wanted to kind of get into, just be due to your educational background, due to what you do for a living and your family's background as well and what you guys do. I
Mhm.
think it's important to share that. Yeah, we are not going to. This is not a. This episode is not to tell you guys what you should do. I think this episode is to. I was just fascinated when I talked to AJ because I have someone who is not just who does this for a living, but who had gone through this education for years under this and knows it better than I would say, you know, most people in the country. So I would definitely say that just because due to his credentials alone. So AJ, if you don't mind just sharing a little bit about your educational background too, so people understand that we're not just two guys on a podcast who have mics and can say whatever we want and preach and get some clicks.
Yeah,
But yeah, please share
absolutely.
a little bit. Yeah, share a little
Yeah.
context, please.
So I actually, like, before I studied to be a professional, I think I mentioned earlier, my dad owned a compounding pharmacy in Denver, starting in the early 80s all the way until the early 2000s. And he was doing like bioidentical hormone replacement therapy. He was like one of the pioneers of it. The point being is I actually started working in the pharmacy when I was a teenager, doing small jobs and being overly supervised by pharmacists and professionals, which kind of led me to be inspired to go into science after high school. So I ended up at the University of Wyoming after high school, and I originally wanted to do pharmacy like dad did. Doing more research into that profession, it seems to have moved away a little bit from, innovation and compounding and more into, big bottle, little bottle, which is something I didn't want to do. So I decided to get a bachelor's in chemistry as well, um, or instead. And I actually have a second degree in Spanish too, which was great. And I
No,
mentioned it
nice.
because it really, like, I found that hard science was really hard for me to do all the time, right? So doing things like physical chemistry, have two labs, advanced like calculus, differential equations, like it was hard.
Hmm.
So I had to supplement it with something. I actually had like really good Spanish teachers in high school. So I went to Catholic school as well, and they were Costa Rican nuns. They're great, fantastic. There was a whole team of them. So we
Yeah.
had like tons of Spanish. Like I tested out of like my first 5 semesters of Spanish, like in my freshman year of college, um, just because I wanted to do something that was like arts focused. And I'm not an artsy sort of person, but like language, I think is important, and it helps people connect to each other more than
Hmm.
it broadens your horizons, it broadens your perspective on life, and it lets you learn about other people. So I actually focused in Spanish literature, which was great, alongside my chemistry degree. And so I had a dual bachelor's degree. Unfortunately, I finished my bachelor's like when the economy tanked in '07, and so I spent a year just doing laboratory science. Like I worked in an analytical lab in Laramie. Like I didn't leave. Um, and then I got an opportunity to do grad school, and I actually studied crop nutrition as a part of my biochemistry. So I was looking at how micronutrients are preserved in crops, essentially. Like the thesis was insane. Like it's very obscure. And the
Hmm.
reason I went in this program is because there was two papers that were studying similar things, and I had the opportunity to go to grad school essentially for free, if I was going to take up the mantle of, you know, essentially breaking the tie between these two papers. Um,
Hmm.
so I was essentially studying crop biochemistry and how nutritional values in plants are preserved throughout propagation. And so, which was really interesting. It's something that I had never like thought of studying. So as my program was in physical sciences, but I was basically based out of the agriculture department in Laramie. So like when I finished grad school, the economy still wasn't super great. So I ended up taking a job in reclamation, like engineering, working for a company, engineering firm that does environmental reclamation. So that's actually where I met my wife, was at work.
Okay.
Um, so we were working on similar projects. That's how we connected. I was essentially doing oil field cleanup and um, environmental cleanup and monitoring of like oil refineries, which was
Hmm.
interesting because in this part of Wyoming, like right on the Platte River, in the early mid 1900s, there was oil refineries like literally lined up all the way along the Platte River. So when those refineries closed down, like they need cleaned up, and so that's essentially what we were doing. Um, I worked there for about 5 years, and at the same time, my dad decided he wanted to move. He had sold his pharmacy at this point, and due to his non-compete, he got back into nutritional supplements. Well, he got together with all of his doctor buddies and naturopathic doctors, chiropractor friends, and networked essentially, and came up with a set of products that in the nutritional supplement world that fit a demand and was in the Denver area, like right when real estate essentially went gangbusters. And
Yeah.
I just can't handle the taxes anymore. Like this is crazy. They're going to up my rent in my building. Like I need to move to Wyoming. I said, well, that's interesting. I'm pretty much going to be leaving my job.
Yeah.
So we found a commercial property in central Wyoming where I was actually living, and moved the entire operation up here. And so, and that's what I've been doing ever since for the last 12 years now, manufacturer. So, but yeah, it is a family company, and we don't just do like a multivitamin or something like
Yeah.
that. We do like specialized formulations. That's just not like a blanket. A lot of
Yeah.
times with those type of products, you're not getting what your body actually needs. A lot
Hmm.
of times, people see a label for a multivitamin and says 100% of vitamin C. Like, oh, that's great. That's what I need. Well, a lot of times it's not exactly what you need.
Mm.
Coupled with, there can be interactions between different compounds in a particular supplement. For example, like take another, a multivitamin. They'll have vitamin C and they'll have something like iodine, right? Iodine is
Yeah.
essential for thyroid function. It's essential for a lot of different systems. It's amazing. Like, your tiny little thyroid can control so much in your body, which is, it's super important. However, if you're taking both of those at the same time, the vitamin C converts the iodine into a form that's non-usable, so your body just flushes it. Okay,
Oh, interesting.
expensive pee. Yeah, that's a
Yeah.
big one that we deal with. In the multivitamin space is the interaction between something like vitamin C and iodine. And the way you get around
Okay.
it is, taking them at different times of the day. That solves the
Yeah.
issue because you need vitamin C, obviously. You need iodine, but just together, it doesn't it doesn't work. Like it
Yeah.
renders the iodine completely useless by your thyroid.
Mm. That's
By your
good to
body.
know. Yeah, it's great. It's great to know. I
And
think,
like 87% of the American population is deficient in iodine. We were all told that you get sufficient amount of iodine through iodized salt for years, post World War II, um, and that turns out not to be true. Like taking
hmm,
potassium iodide that's in your salt, like in your table salt, just isn't enough.
interesting.
Yeah, I could go on for a year and on and on and on.
Yeah, I had no clue at all, which is like
Yeah,
it's probably my own ignorance, but
we
yeah,
no,
I
not.
had no
I mean,
clue.
how would you know, right?
Yeah.
You're told that you're getting enough iodine in your salt.
Yeah.
You're being told that you're getting enough iodine and vitamin C, like in your multivitamin. But how would you know that there's an interaction unless there's people that are actually like researching it?
Hmm.
So like what happens is because vitamin C is an ester, right?
Yeah.
It's an ester is what the classic compound it is. Iodine gets converted to iodate, and it is rendered completely useless in the presence of vitamin C. Like
Mm.
when I, because we manufacture iodine supplements in our lab, that's how I clean my lab is using vitamin C because it essentially like sweeps away the iodine.
Mm.
Yeah, it's
Wow.
crazy. So yeah,
Yeah,
that's
that
just what we
is.
do. We do a lot of research in our lab too. Part of the lab is analytical, so we do. It's a wet lab, so we do a lot of
Okay.
like research and development. We do work with the CDC. We have um, they're kind of like our oversight, right, in our lab.
Mhm.
It's
Right.
it's our regulatory for our laboratory. So we do testing. We work with naturopathic doctors, chiropractors, brick and mortar to do. You can actually like test this at home. Iodine sufficiency and how your body's using it. But yeah, and that's the tip of the iceberg when it comes to compounds that may interact in your multivitamin that is just are essentially making expensive pee. Um,
Yeah, I can only
so
imagine. Right.
it's important for people again, like what you were talking about earlier. It's important for the consumer to be informed and make their own decisions, right? So
Yes.
I'm taking a multivitamin. You may have that interaction. Going back to our conversation about baby formula and like corn sugars, a lot of people are into gummies and that sort of thing. And like, look at the
Hmm.
label of gummies and like, look at the nutritional value. It's just not there.
Yeah,
Um,
that's
why
good to know.
it's actually like more valuable for you not to take the gummy in some cases
Hmm.
because there is no nutritional value. And then trying to put nutrition into a form like a gummy is like it's hard to do. It's
Hmm.
not somewhat impossible because you're trying to ensure that your nutritional components are all there in equal potency every time in something that is really unstable. And coming from like hemp and cannabis, where um, most of the ingested uh, cannabinoids are in a gummy, you just see time and time again where people are failing potency because like one time you'll get a lot and sometimes you won't get any because it's hard to ensure repeated dosage.
Oh, gotcha. So you're talking about like in the edibles, like the gummies and stuff like that. Yeah.
Yeah.
Interesting. Okay. Well, that's also something new I learned.
Yeah. Yeah. Like
I yeah.
some people, completely off topic, but some people, they're like, oh, I ate a gummy and, THC gummy or a sleep gummy to whatever. It's like nothing happened. And then the next time I ate another one and nothing happened. The next day I go back and I got completely just steamrolled by eating a half of one. You
Yeah.
hear that all the time. That happened to me.
Hmm.
Like, in the early days of
Hmm.
post legalization in Colorado, and that
Yeah.
blew me completely away. It's like, why is this happening? And that's how my scientific mind thinks. It's the same for nutritionals. Like, why is this happening? Because it tastes
Right.
good. It's cheap to make. Um, and the
True.
consumer, like, a lot of times doesn't know any better. This is
Yeah,
whatever
I
makes
think
us making this,
that's really accurate. They don't know any better.
yeah. So
Like,
I guess, the takeaway from nutritionals, whether it's nutritionals or cannabis or whatever, is like, just do your research. Um,
so, but that's good. It's good you say that because I'll get into that research part too. With that background and your family experience, and by the because then the girls were this is 8 years ago, right, when they were born.
yeah. Yeah. They're 8.5.
Okay, so you're already out of your masters, right?
Oh yeah. Yeah. No, I
Okay,
was, yeah.
okay,
Long.
perfect. So you're already out of your masters. What? And this is just something for people who are going through pregnancy and they have the babies. When it came to you guys' nutritional diet,
Mhm.
what were some factors that you remember, like you guys had always kind of like how did your background and education for you and your wife, how that factored into how you guys like, what she did when she was pregnant and afterwards with the babies?
Yeah. So the iodine was a big one for her, just because of its effect in different bodily systems, and the ability of the thyroid to regulate, um, you know, what your body secretes. So the iodine was big. I actually was working on publicizing a paper, writing a journal article on how iodine, being a really essential compound, can transfer through breast milk, and your infants can be ingesting it, which is essential for small children. I'm not making any
Mm-hmm.
recommendations here. We're gonna, again, like I can't, I'm not allowed to officially say this helps.
Yeah.
The FDA comes down really hard on comments like that. I'm just saying from, anecdotally from what we were doing with, the supplements, at early stages of development in children, iodine is essential. Like it's probably the number one, if not, behind protein, um,
Mm-hmm.
essential compound for children to have. And it is very well documented about um, cognitive development in children that are getting
Mm-hmm.
iodine in their diets. But aside from that, protein, your wife especially, your the triple mom, to keep up with that demand on her body, like that's super important. Um,
So how for the iodine and the protein, any examples of like things that ate,
for us,
took,
it was like
drink?
those protein drinks. She says she'll never
Okay.
look at one of those things again. She was drinking like 6 of those things a day. She's consuming like 100 grams of protein a day,
Oh
or
wow.
something, maybe more. And a lot of that is not just the protein drinks, but like steak, because
Steak.
like if your diet allows that, steak, chicken, healthy fats, super
Mm-hmm.
important. And you get a lot of those through diet. Um,
Okay.
not just eating like a bunch of carbs. Carbs are important, but healthy fats are importanter. you
Yeah.
know, um,
Mm-hmm.
and you got to make sure you're getting plenty of protein. Obviously, your doctor can tell you more about how much protein you need to be consuming because they
Right.
probably know a lot more than I do. But they, they're a healthcare professional, so they can have a lot that bigger bearing on what you should be consuming. But for us, is the protein drinks, steaks, healthy fat, supplementing um, with the iodine, of course. And then she was, you're working on building a lot of cells quickly with the children. So something like as far as supplementation goes, something like a CoQ10 or something, biotin, healthy, building healthy skin.
Mm-hmm.
And you can get those through supplementation. And then important for a lot of moms, again, anecdotally, what works for us is like a vitamin D and K, super super important. Um,
Was that something that you guys had also like talked to her OBGYN too about? Like when you guys were like when they asked like or anything like that, or was that something you guys just did on your own?
she defaulted back to us because she
Okay.
knew our background. She's like,
Gotcha. So she was like whatever you guys
yeah,
think. Okay. Makes
yeah,
sense.
yeah, and we're actually still kind of getting that. At the girls' checkups, like, oh, this looks great. And we're like, well, what do you think about this? And she's like, I don't know, that's scary.
Yeah.
And apart from that litany, healthy sugars, simple sugars, fruits,
Okay.
vegetables, that sort of thing.
Yeah.
But as far as like routine supplementation goes, it was aside from diet, it was the iodine, the CoQ10, the biotin, and then the vitamin D and K.
Mm-hmm.
Vitamin A also super important, for developing bodies as well.
Right. And I think I don't buy vitamins like I don't for myself or my wife or anything like that. So curious, I guess if you were like when you guys were going, not for just for you, but for just say anyone who's just leaves the house today, are these typically things that you find at we're talking about like the Targets, the Walmarts of the places, or we're talking about more of like nutritional shops, like for these specific vitamins? Like,
Yeah, I mean, Vitamin Cottage, um, Like if you're going to go to big
Yeah.
box stores, a Vitamin Cottage or somewhere, because I don't know if I would buy a supplement from
Okay.
Walgreens,
Yeah.
but like at least like a natural grocer or like a Vitamin Cottage, they're screening, like dealing with these stores, for brick and mortar with our company, like their
Hmm.
screening process for like quality control, third party testing are like way more stringent than somewhere like Walmart.
Gotcha.
And like we do quite a bit of business, both our label and private label through, like the Vitamin Cottages of the world, and Natural Grocer. I don't know if that's a ubiquitous thing, but Vitamin Cottage for sure is.
You're talking about Natural Grocer,
Yeah,
the actual like chain, right? Like the
yeah,
fam,
yeah,
like
yeah.
the okay,
Yep,
yeah.
yep. They are very, very picky about their suppliers, and B, like the
Okay.
level of testing that they go through to supply their products.
Do your products and you don't like I guess you don't have to share, but your products do you distribute to any of those stores?
Yeah, yeah, we do.
Yeah. You
We
okay.
do some private label through there.
Gotcha. Oh, okay. So
Yeah,
private label means like it's under their name or what?
it's under their name, but my formulation.
Gotcha. Gotcha. So it's not sold as your product, but it's sold as Natural Grocers Vitamin A or whatever. Okay.
Yeah, I can't
Makes
tell
sense.
you
Okay.
which ones they are because I have NDA, but
Yeah, no, that's okay. You
yeah,
don't need to. I was just
yeah,
yeah, I was just
yeah. But
wondering
like a
on that
Natural
because
Grocer, Vitamin Cottage, like I said, they're
yeah.
like it's actually pretty impressive. I definitely
Cool.
would advise, again, like if you can swing it, like I would go into a place like that,
Okay.
small brick and mortar rather than like gigantic, because they're, or even Amazon, really, because a lot of
Yeah.
times with Amazon, like it's hard to like juggle and go through just like based on reviews on what's good and what's not.
Hmm.
But if you can swing it, that would be my recommendation, is to go into a place like that. Um, the
So
other
in
one I
your
didn't mention was like a probiotic, super important
okay.
to be taking routinely, and for for your partner, if you're especially if you're nursing, like iron, lots of bioavailable iron, like in a ferrous fumarate form, which is the most bioavailable. Like it's
Hmm.
you have to, if you're going to keep up with
Yeah.
it with breastfeeding.
Okay. And yeah, I think the vitamin, I guess from the health side of things, like you I think it's obviously that you knew I mean, you got to all like the mom, the dad, like the family's got to do their due diligence, and I think consult multiple parties. I would say probably right. Like I think that's
100%.
probably a fair point, right? Like I mean, you go to natural grocers, you buy probiotics or you buy whatever vitamins, or let's just say you go to any of these vitamin colleges, but then you should also consult with the pediatrician or your healthcare team to let
Oh
them
yeah,
know, like, hey,
you have to.
I'm
Yeah,
gonna. Okay, yeah, that's okay. That's what I was kind of like
that's
wanting
a.
to make sure that was clear, right? That's like
But
that goes
don't be
without saying. Like you should,
surprised if they're like like
yeah, yeah,
because a lot of times they are taking just the recommendation of big pharma and
mm-hmm,
companies that work with big pharma,
mm-hmm,
say, oh, like this one,
yeah,
whereas like there's and if you're getting constantly pushed towards a product, you don't feel comfortable, like go somewhere else. You have the right to like go to your pediatrician or your healthcare provider and be like, I don't know if I really agree with this. It's
yeah,
always best to ask questions and be inquisitive, because if you're not getting the answer that like sounds right, and as a parent, you know, red flags could be going off. Like, don't just, if
mm-hmm,
you're getting a feeling like that, like take a step back. You're essentially like investing in your child's future. Um,
yeah.
that maybe is a little bit drastic, but like it's essential to
No, you are.
provide high nutrition at a young age.
It is. It is, and I think with you're just learning more about what's healthy and what's not, and it's just not black and white like the information that's out there. And it sucks because not everyone is educated to really understand a lot of these studies, these ingredients, like so you're forced to rely on like other professionals, and that's the hard part because you're like there's so much more information coming out. I mean, we see it with the FDA now, like what they're banning and what they're like as we're learning more, it's like the red dyes and all these things that they're
Sure.
knocking out, and you're kind of like, wait, these countries don't even have that legal in there, and
Yeah.
like we have all this crap legal in the United States, and
Yeah.
then you like look at the other countries and you're like, how does that make sense? Like, how do they? Why did they ban it, and then why are we not banning these things?
Yeah.
Like,
Yeah. I mean, look at
there has,
EU ban list, banned substance list. It's crazy.
yeah,
Like
it's
look at
insane. Like,
go to a place like
yeah,
Switzerland or Germany or any EU country for that matter, or the UK. In their case like Brexit or whatever. But like, look at their like non-accepted food additive list. It's insane and all that stuff.
hmm
Yep, we can get that here. Oh, yep, I saw that on the shelf. Like it's
yeah,
crazy. And there's like, it's not just because they want to control the population, is because a lot of times like it's just flat out hazardous for your health. A lot of the
hmm
stuff is are mutagens
hmm
or compounds that mess with your genetic makeup. And so,
hmm
yeah, I mean, there's a basis behind it for sure. You know,
right,
and
right,
I think we're on the right track as a country to like opening our eyes and being like, wow, maybe we shouldn't be using these products. And it's not just like compounds that are in food items. It's like
hmm
Teflons and that sort of thing, microplastics. Like, man,
yes, hmm
a lot of that stuff
yeah,
it's not just like pots and pans, right? It's like your dental floss, like that's scraping microplastics. Like
right.
your toothbrush, your whatever, your
I
clothes.
know it's
Yeah.
scary and it's frustrating because you feel like there's no way out. Like, you know what I mean? When you look at all this, you're just like, we're just buried in it. Like, you know what I mean? Like all
Yeah.
this different things. And I do think as the it's hard with this internet age, like where we're at on this like phase of the internet, because it's like the misinformation is just so it spreads like wildfire, and people who are vulnerable are so targeted easily. Like
Mhm.
they're the easiest targets. So that's where I will get to my next question for you, is because I think when you experience something that is unique to like yourself and a handful of the population, right, that is also going through this, but it's not everyone. It's just like a whatever piece of the pie that's experiencing this. Sometimes you look for answers,
Totally.
and I think a great answer here is like I think a lot of parents who are dealing with kids on the autism spectrum,
Sure.
you're going to find kids on higher needs, lower needs, right? And you're going to see all that. So sometimes you look for answers, trying to see like what can help our child, like what can help them, like how can we help their life, like their day to day, like
Right.
whether it's methods to keep them calm, collective, like what I mean, like things like that to like make it easier for them to go through their routines, to eat better foods, like to
Sure.
help them, what I mean? Like you're looking at all these things. So I think that's a perfect example because a lot of kids, their developments are they go basically like they all develop different range, like they different speeds, but also some kids speak a lot faster than others. And
Totally.
so the ones who are delayed on speaking, what you will see is a lot of information like on TikTok. You'll have like influencers say, check out these ingredients that I'm putting together that helped my nonverbal kid speak. And then you get it speaks to it speaks to like a small demographic that is dealing with that, and they're kind of like, oh wait, this person said this worked for them, I'm going to do that. But then when you peek behind the curtain, you're kind of like, wait a second, this person's getting paid. And then you
Yeah.
look at all the ingredient, and then you're just like, wait, this shit doesn't work. Sorry, excuse my language, but you're like, this doesn't work. Like this person's just trying to sell something. So that's what I meant about like the gullible side, because like I just used autism as an example because my son is nonverbal, and so I remember seeing a video like that a couple years ago when he was like 2, because he wasn't speaking. You know what I mean? Like he was doing like one words every so often. But when I
Mhm.
had seen those TikTok videos, you're kind of like, whoa. And you get these people in the comments commenting like, oh, this helped my kid. This helped my kid. But then you're like, okay, those even real comments? Like, you know what I
No,
mean?
it's a
Like you're just
pyramid
like,
scheme. Yeah.
yeah,
Or
yeah, it's
that.
scary. It's the misinformation is scary. So that's just an example. But I guess from someone with your background, I mean, what would you recommend as a great research protocol? You know what I mean? When you're looking into new products, like if you're kind of like, hey, I want to try this vitamin,
Sure.
how can I like learn more about it? Like, where should I learn more? Like, just stuff like that, I think to help people like do their own due diligence.
Yeah, I mean, first and foremost, I would definitely say that looking into the ingredients list, looking into the manufacturer, you know, I would personally err on the side of caution of the origin
Hmm.
of the supplement. There's a scary amount of supplements that are coming from foreign countries that are not guaranteed analysis that there's even anything in there.
Hmm.
Particularly Southeast Asia, or you know, there's a reason why their own people want American-made supplements. We have a huge demand from
Hmm.
China for like supplements that come from the U.S. Like for us, like it's a huge part
Hmm.
of this because they don't want to take their own supplements. Like if that's not a red
Interesting.
flag, I don't know what is. Um, Secondly, any supplement is going to have some sort of filler. Most of the time, it's like a plant derivative, which is safe. Um, but a lot of times, you get the gummies and those sort of products that are corn syrup based or gelatin based. And a lot of times they're getting sneaky now and just saying plant based. Well, corn is plant based, right?
Ah,
Um,
that's
don't be a
interesting.
stranger
Uh-huh.
at looking at the nutritional facts panel
Hmm.
and seeing, sugar, calories, carbohydrates, things like that. Because you're going to want to limit the amount that, your child or yourself intake. Um, it's good to have a lab that is like an FDA approved or monitored lab, and a lot of manufacturers will have that like either on the bottle or go to their website. You'll be able to tell a lot about
Okay.
who you're buying from if like you go to the website and it's not throwing any red flags as far as like where it's being
Mm, yeah.
manufactured, because a lot of what we're seeing too is a lot of companies are calling it an American made supplement, but it's being made overseas and comes to LA or somewhere, and it's being actually
Mm,
like packaged here, and they're calling it American derivative,
gotcha.
made in America or whatever, when it's
A
actually
lot of sneaky
US.
language.
Well,
Yeah.
yeah, I mean, people just like you said, people just want to make a buck. They don't
Yep.
care how they do it. They don't care if they're
Yeah.
actually like caring for people's health.
Yeah.
I do this because I enjoy helping people. I like people feeling good. I like people having a
Hmm.
high degree of health. Um, and we'll chat in the future about where that comes back for just nutrition and mental health and that sort of thing, which I think is for a completely another segue episode. But
I
for
know. I
now,
know.
I think
Yes.
that it's hard though. Like in the U.S., when we're being pressured to go, 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 like make snap decisions, like you don't have
Hmm.
time to do this. Like this is one of those things that nutrition requires you to take the time to do the research. Like it's
Yes.
going to take you 30 seconds to go on the internet. Don't just ask Dr. Google and AI, because we see that there is a lot of misleading information coming from AI. Yeah, is it useful? For sure. But like
Hmm.
going directly to the source is your best bet. Um,
Yeah.
I mean, those are my biggest rule. Those are my biggest considerations for purchasing something. And I think that
Well,
a lot of people out there will find an equal value trying to find nutritional supplements that you'll be able to cut out a lot of the fat by going and doing your own research.
well, it's great to share. I appreciate that because I think it's important to give people some, some tips that I think like, because we get a lot, I got like over 350 downloads for the 13 episodes I've done. So it's like, 27 listeners per episode. And, as I share this with more people, I think it's important because like you said, the way us as the U.S. is just kind of like, yeah, make fast decisions and like, act quickly and all that. You skip over like these important things like nutrition, and you kind of just take things at face value and just be like, okay, this says this says that, that's great. Let's just go. And you don't really, double check. So that's good. And that's what I wanted this discussion for, is just a discussion. That's it. Like we're not advocating one way or the other. I think you have your educational background, your work experience, want to be able to help people, help them do their own research and supply them with knowledge and tools to make sure they're, helping them make their right choice.
Right. Yeah, no, that's 100% on point. For sure.
And I will have you back for a part 2 for
yes,
for mental health. Yeah,
because we didn't even get to touch that. Beyond nutrition, and it's not just like a dads of triplets thing. It's being cognizant of things like mental health, sleep, and like asking for help. And I think that those are all things that I think all triplet families can relate to, and it's just not a resource or that sort of thing. So, or not socially acceptable or whatever, what have you. So, I mean, I like I said, I live in a place, I live in a place where, in Wyoming, where getting mental help was taboo up until like 2 or 3 years ago.
Yeah.
They're like, you're like, oh, well, that just means you're weak. Well, no, it means I'm making a freaking smart decision for my own health, right? Like mental health and, nutritional health are probably two of the most important things you can do for yourself, besides getting a lot of exercise and, exercise, mental health, and good diet, and drinking lots of water.
Yes. Yeah. Yeah. Well said. I think, I really thought this was an insightful conversation. I learned a lot. Definitely helped.
Yeah. Thanks for having me.
I put a lot of things into perspective, and thanks for sharing about yourself. I'm glad the triplets are doing well.
Yes.
All girls.
Yes. Yeah. They're 8.5 now and in 3rd grade, and, they're thriving, which is great. And just trying to, they don't have to be rocket scientists. I just want them to be good people.
Right.
That's all we're trying to do. So
that's awesome.
Yeah.
Awesome. Well, AJ, thank you for coming on. I hope, and I not hope, I know people will find this conversation insightful, and I hope they do walk away with a lot of new things to think about and, learn new things. And thank you everyone for listening. You guys can follow along on social media at Triplet Double, Instagram, TikTok, YouTube, and Threads. So if you have any further questions for AJ, please reach out to me. I'd be happy to connect you to, and be able to connect you with AJ. And if you guys have anything else to ask him, just let me know. But thank you everyone for listening. AJ, thank you.
Yeah, thank you so much. Appreciate you having me on, Isaiah.